Hi everybody, welcome back to my channel. This is Tooth Be True. Super excited about getting started today. So today we're going to talk about what's it like to work at a corporate office versus a private practice and how do you choose between the two. So that is a great question. A lot of new RDAs or new dental assistants don't really know what they should choose. So it's always kind of great to get a feel for both because you may prefer one more than the other. It's really a preference. Me, with my experience, I have worked for private and corporate, and they both have pros and cons. So I'm going to start off with the pros for working with a corporate office. So with corporate, you have structure. You have an HR department, you have a manager, your doctor's not your boss, and there's things in place in order to implement changes. Like let's say one day the doctor wakes up, he's like, I want to go ahead and remodel this office. He can't just do that, or she. They would have to go through a system and it would have to get approved by higher ups in order to do any kind of huge changes like that. So that's the positive thing about corporate offices, is that doctors can't make the final decision. And sometimes it's good because they're a doctor. They're not made to be a manager. He or she is made to be a doctor, and they went to school to be a doctor. So it's always good because you have the right people in the right place. Everybody has a job. You have a manager who has manager experience. You have a receptionist who has receptionist experience. You have your treatment coordinator. You have your dental assistants, and then you have your doctors. So it's good because there's structure and there's things in place that helps with a good flow. Now, that being said, whenever it's corporate, a lot of times it's all about the numbers. So corporates are gonna work you like a dog. So let me just give you a good example. I currently work in a private practice and I see about 24 to 30 patients a day. Now, when I was working corporate, I was seeing, well, I guess the office was seeing about 100, and then I think the most that I've ever seen was 140 patients in one day. Now that's a lot of people, and yes, you usually have a bigger team, but they're going to squeeze in these people because they want numbers. And if this is a new patient and they want to get them started, they're going to squeeze them in at 4:45 p.m. or whatever time of the day that your office is getting ready to close. They don't care. So yeah, that's the con. Now, bonuses are not that great, and I guess I can't say that. So I guess it really depends on what corporate office you're working for. I have not worked for a corporate office that I'm like, oh wow, I can't wait to meet my goal because I'm gonna get a huge bonus. No. I think the bonus is like the most I've ever seen was like $300. But then after they take taxes and all that good stuff, it's really not that much. So me being a clinician, I wasn't like, yeah, let's go ahead and start this new patient 5 minutes before closing because I'm gonna get such a good incentive here. No, I was just like, oh my God, they just added another new patient to the schedule. Let me put my poker face on and get going. So unfortunately, with corporate offices, they will work you like a dog. Pro. Well, there's a lot of benefits. So a lot of corporate offices, they have 401k, they have health benefits, they have dental. So that is that they have these benefits in place for dental assistants. Those are the pros and the cons, just to kind of give you an idea. Now this is all my personal experience and my opinions. Now, every corporate office, every practice is run differently, but I do want to point out the highlights of majority of what you're going to get at a private office and what you're going to get at a corporate office. If you're a person who likes structure, then corporate's going to be for you. If you're a person who wants a little bit of flexibility to not feel overworked, you're gonna probably like to work at a private office. So now there's pros and cons to each place. So now let's talk about private offices. So a private office is run by the doctor. They are starting up this business. They're so excited and thrilled, and it's like their little tiny baby. Now, that being said, they're gonna be pin and pinching everywhere. And I'm sorry, but it's the truth. And if you try to put yourself in their shoes, you know, if you're a doctor, you just got done paying for all this schooling, and now you're investing in a business and you're trying to build new patients, new clientele, that's gonna cost a lot of money. And now you have to pay for labor. So a lot of times, like these upcoming doctors, new practices, they don't have a lot of money at the point, at this time. So you're probably gonna get lowballed in working for this job because they don't have a lot of money. Now, once this office is established, usually they do compensate more and appreciate you more because they know what it's like to do the dirty work, right? To be at zero and then having to do every single job and then move up. Well, not move up, sorry. And then, you know, just eventually only be worried about doctor stuff. So they do appreciate their staff more. They tend to compensate you more once they are able to. You build a good relationship, more like a family dynamic relationship, because it's usually they're small practices. They're not a big, huge team. More of an established practice, like let's say you get to a practice and they've been settled in for like maybe 4 to 5 years and they're doing good. They're now having good revenue coming in and they're building. It's a good opportunity for growth. So you get in an office and the office is starting up. You want to get in because if you want to grow into something more than just a dental assistant, you have that opportunity presented to you because you're going to be able to be cross-trained in multiple things. Now, in the beginning, it may suck because you're like, oh my gosh, I'm doing like 20 jobs, but I'm getting paid like $15 an hour to do all this. But wait a little bit because you're gonna be able to excel from that and use that experience and take it somewhere else where you do get compensated more, or eventually just grow in this practice and then you can just become a manager one day. So there's a lot of pros and cons with that. Flow is gonna be a little bit better because, you know, it's private practice. Doctors want to run it like private practice. They don't want to run it like a corporate office where the patients feel like they're just another number. So with private offices, you're going to have, you know, a less stressful type of environment where you're not like, oh my gosh, let me wipe down my chair, grab the next one, because you're going to have a line of people waiting to be called back. Like, it literally feels like a factory almost when you're in corporate offices. It's so sad, but it does. So private practice, you have that benefit of, you know, having a little bit more stress-free job and be able to concentrate in your work and provide the best service to your patients. Now, the con is that a lot of times the doctor is very micromanagement. And that's because they're penning pitching everywhere because they have to control their budget and be able to be afloat and make production. So there's a lot of penning pinching with private offices, they're very controlling. If they don't have a manager, then usually they are the manager, so they're trying to be the doctor, they're trying to be the manager, they're dealing with all the patient complaints, they're dealing with the assistants saying, I need this, I need that. So it's a lot on the doctor, and sometimes they're not in the best mood because they're so overwhelmed. They're also having to worry about their overhead. So it's a lot for the doctor, and it's not very structured. Now, when these private offices who are growing and they have managers in place, treatment coordinators in place, and they're flourishing, then that's great. It's honestly a better feel because you're getting your foot right in when they're about to like pop off. And then sometimes what happens with these private offices, they tend to sell. They're either sell out to a corporation. They're getting so big so fast that it's just too much, and they're at this point where they need an HR department. They need more structure involved, and then you'll kind of get bought out and then get to transition into this new corporate / private practice lifestyle, which those are honestly probably the best, where you have benefits, you have structure, and you still kind of have that private practice feel. Those are hard to come across by. A lot of times private practices have better hours. Like for example, usually they're like 9 a.m. to 5 or 8:30 to 4. So the hours are more family friendly, especially for those assistants who have kids and you have to go pick up your kiddos and you're like, leave, and you're not feeling, well, I can't leave my team because I have 20 or 10 patients waiting in the lobby that need to be called back, and you're like, I can't just sneak out of here. So that's a good thing about the private practices, is that the schedule's not going to be crazy and chaotic like that. Usually they're more flexible with families. The hours of the office are going to be a lot better and more family friendly. So that's a pro about that. Honestly, you got to choose your battles. What do you prefer? And for those who have experiences that they would like to share, please comment below so that way other assistants that are upcoming into the field can get an idea of what to expect and also help them make that decision on, you know, should I do private, should I do corporate? And if you don't know, just get your feet in the water and try it out. There's nothing wrong with that. It could be where sometimes you find a private practice, but you don't like that atmosphere or the culture, and it's the same thing with corporate offices. You're like, man, I don't really like the culture or the dynamic over here. So you also have to find the right office that you feel like you fit in and you feel comfortable with, and the ethical background of it that you can represent and say, hey, I'm proud to work with, Dr. blah 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 blah. So those are just some suggestions for new assistants that are going out there trying to make a decision on what where they should go as far as like private or corporate. So yeah, I hope this helped some assistants out there to make a decision, or anybody who's in the dental field trying to get a new, getting their foot in the door and looking for jobs. Again, these are just my suggestions and my past experiences. So anybody who would like to share, please comment below. Please like and subscribe. This is gonna help grow my channel, and then that way I can help post more helpful videos in the future. Thank you. See you next time.